Literally, I called an airline a couple of nights ago, and without any embarrassment, a voicemail came on and said, "Your wait will be an hour and 15 minutes." I can't even imagine 10 years ago any industry would be telling anybody that their wait would be an hour and 15 minutes.
Dr. Jonathan Baktari.
You can see it. I mean, it's crystal clear.
I think it's going to really revolutionize things.
Which is a big game changer.
Hi, welcome to another episode of Baktari MD. Today, what I want to talk about is your doctor's relationship and what's happening to doctors' offices and businesses. More and more doctors are becoming employees of large medical practices as well as large hospital groups and sometimes, equity firms that have bought out big healthcare systems. In fact, the data on that is in 1983, 75% of physicians were in private practice where they owned their practice. In 2018, it's 46, and I'm sure it is less than that now. So the vast majority of physicians now work for someone else. And the question really is, how does that impact you? How does the fact that your doctor is now just picking up a paycheck, and how will it impact you? Well, I think what we're really seeing, besides the doctors sort of becoming employees, we're seeing a consolidation in the healthcare industry like other industries. So we're seeing hospital chains buy other hospital chains, and equity firms get involved, and big corporations that are in the stock market buying practices, hospitals, hospital groups. And what does that bode for you? I'm sure if you live in a metropolitan area, you've already seen a lot of that. And I'm sure some of you have already seen the difference that makes. What happens when consolidation occurs in healthcare, like it's happened in many other industries in the last 10, 15, 20 years? Well, before I tell you what has happened to them, let's look at industries that we're all very familiar with, just like healthcare, that consolidations happened, and see if that has led to incremental improvements in either the type of service, the quality of service, the speed of the service. And I think the answer will be pretty clear. Let's take the airline industry, which has seen massive consolidations in the last 10, 15 years, and certainly in the last few years. Airlines like Continental, Virgin America, Northwest, America West, and Pan Am, TWA, which were gone long before that. All of that consolidation has now left the airline industry in the hands of only several massive airlines. And I think when you look at what has happened to air travel in that interim, I don't think there's anyone here, let me see a show of hands, who thinks airline travel has improved, whether it's the quality of the service, the food on the plane, having to pay for every little nickel and dime, bags and meals and water and everything else. And the question really is, has consolidation helped? And has it dramatically changed the experience in a good way? I don't think there are many people who can say that consolidation has improved. Literally, I called an airline a couple of nights ago, and without any embarrassment, a voicemail came on and said, "Your wait will be an hour and 15 minutes." I can't even imagine 10 years ago any industry would be telling anybody that their wait would be an hour and 15 minutes, and then literally play music for an hour and 15 minutes until somebody in another country picked up the phone. As I've said on other shows, that screams, we don't really need your business, but you don't really have many places to go. And I think there becomes a psychology where if there's only a handful of people left after the consolidation, I think they feel like they can probably piss off equal number of people that will vow never to use them again and go to their 2, 3 other competitors. So that sort of comes out in the wash. So they really have nothing to lose by providing bad service. And there is no market forces that encourages them to improve, wake up in the morning, say, what can we do to make this better? Granted, the airline industry has a lot of other issues, and that's not the focus of this. But what's interesting is when you see the dynamics work out, when massive consolidation occurs, the waits never get shorter, the service rarely improves, and there is a sense that they need us more than we need them. And we've seen that. The other industry, of course, the hotel industry is also consolidated. Most of the major hotels are owned by several firms, and so that experience is changing. And then look at the cell phone industry, where we've had massive consolidation to only a handful of major cellular phone companies. Has your wait calling a cell phone company gone down? Has the service gotten significantly better? Is the customer service better? Let's take all of this and say, okay, we know when consolidation happens in the airline industry, hotel industry, and the cellular phone industry, that things are not going to get better. The only thing that gets better often is really the profit margin of those industries that are consolidating. I think a lot of us physicians who went into medicine, of course, we realized that medicine was a business, but for a lot of people, being a doctor was a calling. Some people it was a calling from God. And for most of us, we felt like we were there to do the right things, to be a patient advocate. And good news is, the vast majority of all clinicians feel that way. However, there are now outside pressures, because once someone becomes an employee, it's not up to them anymore what they're willing to do in terms of their commitment to any one patient, or the amount of time they want to focus on any one thing and what's important to them. I mean, obviously, physicians still have autonomy when they're in the patient room, but there are other forces tugging at them, including the fact that their metrics are being kept on their utilization, on their pattern of referrals, on their pattern of writing prescriptions. Are they writing for expensive medications, cheap medications? Are they referring more to GI doctors than other people? Now, of course, on some level, that's good, because we do not want outliers. But the question really is, when you have that, plus the financial pressures involved in seeing a certain number of patients and having a certain quality score on metrics that don't necessarily, the physician may feel, really conveys quality, and so they don't really get to pick what is the most important thing in their quality necessarily. Now, of course, these are broad statements, and I think most physicians somehow, despite all those, manage to look out for their patient and do the right thing. But you can't help but think having outside forces, corporations, large medical groups, often for-profit, making an impact. Now, some of that impact is good. Were there physicians who, when they were totally autonomous, needed to, have some of their practice patterns addressed, some, whether it was writing prescriptions or whether it was referring or what have you. So yes, some of that is good. But the question is, what are we giving up? Physicians who are simply employed and don't necessarily pick and choose what they want to devote most of their time to, it can make an impact. For example, let's take the medical record system, and I'm going to do a whole video on that. But the electronic health records that they use is not one necessarily they choose; it's imposed upon them, and what they have to do to comply with those medical records often requires the physician to spend up to 15-20 minutes of every visit working on electronic medical records. And that's time they're not spending with you. And really, they don't have a choice of choosing a different system necessarily, or, addressing it in a different way, because once you're employed, the rules of the road are set by the employer. It's not like you can go to a major firm and say, what, I really think this software needs to be modified so I can spend more time with my patients. That's just not the kind of flexibility you're going to have. You would have that kind of flexibility if you were running your own show. You can pick and choose what electronic medical records, what policies, procedures, what cancellation policies you have. Will you stay if a patient shows up 15-20 minutes later at the end of the day? Won't you? Do you have other commitments that you have to go to? Do you have to attend meetings that necessarily don't impact your practice because the healthcare system is having administrative meetings or other things that they want you to do to sort of go along with their system. And I think if you really want to see it, and we've talked about how difficult it is to communicate with your provider when they're part of a system, as often sometimes compared to in their own private practice. Of course, that's going to vary based on specialty and availability of competitors in the market. But by and large, it can have an impact when someone is working for a system. Also, I think you're more likely to see interchange of healthcare providers when you're working with a system than when you have a private doctor. So some of that intimacy that you may have, that long-term rapport that you may have, may not be the same when your doctor becomes an employee. We talked about hospitalists in another video, and I'll provide a link to that. But the hospitalist is one area where it has impacted your ability to have the same relationship with your doctor in and out of the hospital. Some of that is good, of course, but that combined with the fact that your doctor, if you go to the office on a Monday, you'll see Dr. X, and if you go to another office, you'll see Dr. Y. Now that happened in private practice too, but not to the same level that it can happen in large medical practices. And also with large medical practices, there's significantly more turnover. So, doctors now get 1-year contracts, or the contracts have to be renewed, and they tend to leave one employer to go to another employer for different reasons. While that happened in private practice too, I don't think anyone would argue that certainly when a physician is employed, the likelihood that you're going to have that same physician for 10, 15 years is probably less. I think, if you talk to your parents and, people who grew up maybe a decade or two, or who were seeing physicians a decade or two before this, will tell you that having a long-term relationship, especially with primary care physicians, was not that unheard of. It was not that unheard of for people to say, oh, you should see my doctor. Oh, my doctor. Yeah, and I don't think that kind of conversation goes on as much when your doctor is employed, simply because the doctors change, they move on, they get a better offer, better job, better hours, they get along better with a different group. So all those changes are part of the consolidation. And why this consolidation has occurred is obviously just a function of market forces, but it's also a function that I think the solo practitioners, or the practitioners who own their own business, were really in a compromised position. They were not able to negotiate with Medicare and large insurance companies as one individual, like hospital chains can, and as large medical groups can. If you're the largest medical group in a certain metropolitan area, believe me, on some level, you're going to dictate to the insurance company what the reimbursements will be. But if you're a solo practitioner sitting in your office in downtown Memphis, you're not going to dictate to Blue Cross Blue Shield what your reimbursement is. They're going to dictate to you what the reimbursement will be. So you can imagine the economic pressures that physicians who own their practice must feel. And also, as new expenses like bringing on new medical records was sort of imposed upon them, their ability to absorb large capital projects is limited. Unlike hospital groups, which have the cash flow and the capital to incorporate some of the newer technologies. So it's pretty obvious why some of these changes have occurred. And, some of the changes also occurred, to be totally fair, is because some doctors who were in private practice wanted to become employees, wanted to have a better lifestyle, potentially. And there's nothing wrong with that. But I think if we go down this road where we systematically get rid of private practice, once it gets to a certain number, the impact will be really obvious. It's the same thing with the airline industry. I don't think when the first 3 airlines went out, all of a sudden you were paying for your bags and you weren't getting meals. So it didn't happen after the 3rd one. Did it happen after the 4th or 5th or 6th? Who knows when it happened? But I can tell you, as it continued, the changes became much more obvious. So, I think we're in the early stages of just Pan Am and TWA going out. But when the rest go out, when only 5-10% of doctors are working for themselves, I think we're going to see the full fallout of the quality and customer friendliness, and really being able to have that special rapport that I think many people long, especially with their primary care doctor. I think some of that is going to be sorely missed. Thank you for watching. Make sure you comment, like, and subscribe if you enjoyed this video. If you have more questions about this topic or there are other topics you want me to cover, please leave it in the comments section below. Well, I'm really excited. We're going to be launching a new medical series where I go over medical situations you've been through, encounters at the hospital, doctor's office. So send your stories to BaktariMD /contact. Of course, we're going to keep everything anonymous. We're not going to use your name, and we're not going to release any private medical records, just the overall story. And we're going to help you understand and help the viewer understands the context, the content, and what the story really meant behind the scenes from what you've told us. As always, thank you and be well.